Good afternoon, and for those of you joining us from across the country and around the world, good morning and good evening. Welcome to the 2020 NTM and Bronchiectasis Virtual Patient Conference. I'm Amy Lietman, Director of Policy and Research for NTM Info and Research, and I will be serving as moderator for today's session. On behalf of all of us at NTM Info and Research, thank you for joining us. The topic for today's webinar is Fight Back with Food, and we are delighted to welcome Michelle McDonald as today's guest speaker. Michelle McDonald is a clinical dietitian and certified diabetes educator at National Jewish Health. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, overweight, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with multidisciplinary teams of specialty clinics, counseling both inpatients and outpatients. She is dedicated to helping patients use nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. During today's webinar, you may ask questions using the Q&A function on Zoom. Click on the Q&A on your screen, type your question into the box, and then click Send. At the conclusion of Ms. McDonald's presentation, the moderator will read questions from the queue for Ms. McDonald to answer. Today's webinar broadcast is being recorded and will be posted online at the conclusion of our seminar series. So if you miss the answer to a question that is asked, you will have the opportunity to hear it again. Don't miss the last session of our virtual patient conference, Coping with Chronic Illness, with Dr. Kristen Holm on Friday, October 23rd at 2 p.m. Eastern. I'd like to thank our sponsors for this year's virtual patient conference: Insmed, Aflovest, Sparrow Therapeutics, Maxor Pharmacies, and Beyond Air. We are so grateful to our sponsors for their support of this program and for all the work they do to develop new therapies to benefit NTM patients. You'll be receiving an email with a link to our virtual exhibit hall, which features more information about these amazing companies and gives you the chance to learn more about them and everything they're working on. You'll be able to read more about their work, view informational videos, and find links to their websites to learn more. At no other time has there been this much interest in and work on NTM and bronchiectasis. This is a very exciting time for all of us, and we encourage you to check it out because these companies play an integral role in fighting these diseases, and the work they do impacts all of us. You can learn more about NTM Info and Research and sign up for our electronic news at ntminfo.org. You can find us on Facebook, Twitter, YouTube, Instagram, and LinkedIn. And now I'd like to turn this event over to Michelle McDonald. Ms. McDonald, welcome and thank you for being here today.
Okay, so thank you everyone for joining. I have had the opportunity, and I would also say privilege, to work with a lot of patients with bronchiectasis and non-tuberculous mycobacterial disease at National Jewish Health. And I do have a big appreciation now for how much nutrition is important in your care. So I did develop this presentation for a lecture series at the hospital a year ago, and we were celebrating Leonardo da Vinci's 500th birthday. So I picked a quote of his that is attributed to him that connects the concept of resistance. And the quote is, "It's easier to resist at the beginning than at the end." And so the connection here is that food can be a big part of your resistance. And I like to emphasize this with the people who I counsel at the hospital with bronchiectasis and NTM, because that's not always their focus. Their focus is on the treatments, whether that's respiratory therapy or the medications. And I'm here to tell you that food is a big part of your therapy and a big part of helping you resist the infection. So this was a gang sign for that particular presentation. It's the American Sign Language for the letter R. I'm also going to throw this out there that it can be something that you make with your hand as a gesture to yourself that you are doing everything you can to fight the infection. So it's just kind of a fun thing to do, but it's also something meant to empower you, either in thought or in practice. Okay, so in terms of an overview, we're going to hit 4 big points. The first one I've already alluded to, but that is that food is a therapy, and we're going to rethink food this way. It's not just something that you do because you have a taste for it or have an appetite for it, but it truly is like a medicine, and food is part of your fight. So food being a therapy is how you fight back, one way that you fight back. I also want to make the point and emphasize the concept that infection and malnutrition are very linked. So we're going to take a higher level view, kind of a global perspective in terms of how infection and nutrition are connected, hopefully so that you can have that appreciation. We will look at how and what you should be eating, and we'll address reflux. So to get started, in terms of rethinking food, I do want to suggest and recommend that you see nutrition as a component of your therapy. And it's a way that you can fortify or strengthen yourself with actually what you are putting in your mouth. So if MAC or any kind of chronic infection is eating your lunch, and this is something a patient once said to me, and it's true, if it's draining you, if it's physically causing you to have to mount a resistance and fight back, then eating well helps you fight your infection. It also helps you have strength, and it helps you maintain a healthy weight. And it can also help you just restore yourself, especially if you have been underweight or not feeling as well. So in terms of something else you may not have thought of, but I would say in our clinics at National Jewish Health, this is becoming also very important. And that is that while there is no single predictor of who will develop progressive disease, we do know that individuals with NTM, and I would, by association, put bronchiectasis in there, people with NTM and a low body mass index, which what I mean by that is approximately a body mass index of 18 or less, they seem to have a higher risk of disease progression and may be less likely to respond well to therapy. So we are identifying people who have a low body mass index, and we are concerned because we know that that may be an indicator that they're going to have disease progression compared to someone else, and they might not do as well in the therapy that we recommend. And I think it's important here to keep in mind that we're not exactly sure what comes first, because if you're really sick and you lose weight, then it's an indicator that you're ill and you have a severe infection. And that doesn't necessarily mean that you're more likely to progress. So we don't know if the sickness comes first or the underweight. We don't exactly know how they're related, but we do know that they tend to correspond. So it is our goal to get you to use food and nutrition, to eat adequately and to eat the right kinds of foods in order to maintain a healthier weight. And I do have to say that when I talk to women, a lot of times they like being a little bit on the thinner side, or they look at me and they say, well, you're thin. But I have to remind people that you are stronger when you are at a heavier weight. And for some people, that even means heavier than a little bit usual. I frequently find myself trying to get women or patients who are on the underweight side of things, even if you're normally underweight, to consider putting on 5 pounds. You'll be stronger, overall, your immune system will be stronger, and you'll have a little bit of a cushion. And also, as I've mentioned before, if you're underweight or have lost weight, we do think that gaining weight is going to help you restore your strength, as well as help recover from whatever it is you have been through. So here we are back to the resistance piece, that food really is part of your fight. And it is on a physiologic basis. I would also say that it is on a mental basis. If you know that you can control what it is that you're eating and that's part of your resistance, then that's part of the mentality, a powerful mentality that you can bring to the table that will also help you fight what it is that you're going through. Okay. I'll mention this because it may apply to people who are considering surgery or surgical candidates, or need to prepare for surgery. I guess they go together. But malnutrition can lower your immunity and can impair healing. So in our clinics at National Jewish, we often look for a prealbumin. This is a protein that is in your blood that we can measure. We look for that to be greater than or equal to 20. The normal range is 20 to 40, and that's preferred for surgical candidates because we know that you will recover better after surgery if your protein levels start in the normal range. Sometimes we have to take extra measures, whether that's oral nutrition supplementation or a tube feeding, which is a feeding tube that may go into your stomach to try and restore people's weight and nutritional status prior to going to surgery. And sometimes that measure can be life-saving. Okay, so on to the second part. I want to make sure everyone has this appreciation. And if you've heard any of my talks before or seen me speak, you know that I talk about this a great deal. But infection and malnutrition are intimately related. And in your case, the infection may cause a number, that's where it starts. The infection may cause a number of changes. It actually alters your metabolism so that one of the symptoms is you lose your appetite. Sometimes that is the only symptom. But appetite loss is a symptom that shouldn't be ignored and should not be dismissed. Don't just assume that, oh, because I'm getting older, my appetite's lower. It should be seen as a bit of a warning sign that maybe the infection is affecting you significantly. And it's also a warning sign that it may be a barrier. You may have the appetite loss as a barrier to adequate intake. And so to some degree, you need to see the appetite loss not as time to eat less, but it's actually a signal that you need to eat more, and you may need to do it without regard to appetite. You may also have a fever, and that's going to cause your kind of metabolism to rev up and cause you to burn more calories. The infection can also alter your metabolism in a way that you have muscle and fat breakdown. So this is a side effect of the inflammatory process. So if the infection is in your lungs or elsewhere, and it causes a systemic inflammation reaction, then the inflammation can actually cause your body to start to drain your reserves in your muscle and your fat in order to fight the infection. It's kind of a natural byproduct of the inflammation. And that can cause, in its worst forms, a wasting syndrome, which I see a lot of. And because I see enough of it and I see how difficult it is for patients to deal with this, I really try and explain why it's happening, and also explain that you want to either avoid getting there or fight back with food by eating more and eating adequately so that it doesn't happen to you. We also see malabsorption. We see nutrient losses too. Vitamin D is something that we routinely measure in our clinics, and we'll see a lot of people with vitamin D deficiencies. And it's a sign that your needs for nutrients are quite a bit higher than they normally are because your body is in this fight. And so you have this kind of perfect storm in terms of the infection causing a lot of changes, which then can lead to a state of malnutrition, mild, moderate, or severe. If you are in that state, we do connect that to the fact that you're going to have a lower immunity. Your resistance to the infection will be lower, you'll be weaker. You may have weight loss. You may see physical signs of muscle and fat loss. You also may see the micronutrient deficiencies such as vitamin D, but there are others that can occur. And then this can actually impair your ability to fight the infection. So infection can worsen malnutrition or cause it. Malnutrition can then make it harder for you to fight the infection. So this is really the bird's eye view. It's the global view that I take whenever I go in to meet with someone who's dealing with bronchiectasis and NTM lung disease, because you have to realize that you're in a slightly different boat when you have these conditions, and that you need to take food very seriously in order to be as strong as possible. Okay, in terms of how you should eat very purposefully. Treat food like a medicine. I had a patient say, food is my drug, is food my drug? And to some degree it is. It is like another pill or therapy that you're taking. You should therefore take it by the clock and on a schedule, and don't miss a dose, just as you would not miss a dose of medicine. You wouldn't forget to take a pill. You would, in fact, plan it in. You might write it down or set yourself up some reminders. You shouldn't wait until you're hungry to eat, because you might not get hungry. So you're going to have to schedule it if needed. I talk about making eating a practice, make it a part of your daily program and a ritual. It's something you're doing to take care of yourself. If you don't eat well, my concern would be that you start to waste away, and it gets very hard to get back on top of your weight or to restore your weight if you've lost too much. So the goal is to minimize weight loss or avoid it if you can, and then restore the weight, especially maybe once you're done with treatment or once you feel better, in order to recover your strength, strengthen your immunity, and recover, because it does take a while to recover from periods of deficit or underweight. It takes sometimes 2 or 3 times longer than it did to kind of suffer through the acute symptoms or an acute flare. I have some quotes from a patient that I helped counsel. He actually was a tall gentleman, close to 6 foot, and I believe he was under 130 pounds when I met him. And so he met the criteria of having a BMI of less than 18. And I had to talk to him about how to eat, because he had no appetite and he was force feeding himself. And he said, so what you're telling me is I need to start my own campaign for calories. I need to go on a feeding frenzy, and I need to swing for the fences. And I think this really captures sometimes the aggressive effort that's needed to eat adequately, as well as sometimes restore your weight in the setting of chronic illness or chronic infection. He also told me that he really had to unlearn his prior prohibitions about fat, because all of the health conscious media messages that say fat is bad. He was eating very low fat, and a lot of times people are choosing a lot of diet products. But it's important to keep in mind that fat can be very healthy. There are, very healthy forms of fat, even if you have a history of heart disease. And he had to kind of switch, turn on a switch in his head that said fat is okay, and it's actually the key. And part of the reason that is that fat has 9 calories per gram, as opposed to just 4 calories per gram that is in protein and carbs. So it can be a very concentrated way to get a lot of calories. We would, of course, want to pair that with other nutrient-rich foods, but sometimes it's hard to eat a lot of volume, and adding fat to food can help you get the nutrition you need in terms of calories and other things in a very small amount, so that you don't have to eat a feast all the time. You can strategically get enough calories if you are strategic about what you're choosing to eat. Okay, so I've mentioned this, eliminating diet and low-fat items is appropriate. In terms of other ways to eat, I sometimes have to remind people to eat regularly. I know this might sound basic, but a lot of people skip breakfast, or they get up late and they're skipping a meal during the day, or they don't snack because they've never been in the habit of snacking because that wasn't thought of as a healthy habit to have. But I try and emphasize that in order to meet the needs, your needs, which are higher when you're in an infected state, whether that's acute, meaning short term, or chronic, which is long term, and you may be experiencing either one of them. It's very hard to meet your needs for calories and protein and all of your micronutrients, all your vitamins and minerals that help with your immunity if you don't eat regularly. So I tell people that now might be a really good time to start eating breakfast. You might just need to develop that habit. It's something that you would program in, and it might mean you have to look at the night before and decide what to change in order to set yourself up to get up early enough and get a good meal in. I talk to people about adding mid-morning and mid-afternoon snacks because we don't want you to go too long without eating in order to meet your increased needs with the infection. And I tell you to stop skipping meals. A lot of times people are too busy, whether they're too busy with their therapy regimens, which can be extensive, or they're just too busy with life. They have other priorities, they're volunteering or they're working. I try and really emphasize that food has to be a priority. It has to be something that you write in. Okay, a lot of times I talk to people about adding and or concentrating calories or protein in their daily diet. And this is in order to help either prevent weight loss or restore weight loss that's happened, restore weight if weight loss has happened, or just to eat more to essentially maintain a healthy weight. So I might be repeating myself a little bit, but this is what a lot of my counseling focuses on. And I try and make it really quantitative for people. So I try and get people to think about increasing or adding about 250 to 500 calories to their day every day to gain about a half to a pound a week. If you do the math, and your body is not necessarily a strict calculator, but 3,500 calories is a pound. So if you're going to gain that in a week, you can spread that out over every day and add about 500 calories to your day. And so once we know that, then we can start to ask how to do that. And just to bring in a piece from earlier in the presentation, a tablespoon of olive oil, which could be added in cooking to your vegetables, for instance, or to your bread, if you could dip your bread in it, is about 120 calories, just a tablespoon. And so foods that are high in fat are going to help you meet this goal. It's possible you may need up to 2,500 calories a day to gain weight, restore weight. And that's a considerable amount. And so then I can just repeat what I said before. If you're eating only 1 or 2 meals a day, it's very hard to meet that calorie goal. But if you're eating more often, then you can kind of eat more concentrated, smaller meals to really help meet these goals. Your needs for protein are also quite a bit higher. So it's possible you may need 75 to 150 or more grams of protein a day. And you might be asking yourself, well, what does that mean? 1 egg has about 6 grams. So I talk about, appropriate portions of high protein foods. You need at least 2 eggs if you're going to be eating eggs. If you're eating chicken, fish, or meat, which I actually do recommend in this context, it can be more challenging if you're vegetarian or vegan, but I do recommend if you're open to eating chicken, fish, or meat, and I would tend to steer towards, say, maybe the more heart healthy poultry or fish or seafood. But if and when you do eat those, I'd recommend a portion that's about 4 ounces. And that's the size of my hand, which, might be hard to see here, but it's bigger than a deck of cards. It's bigger than your cell phone. And it's something that I would recommend you try and measure out. So when you are buying these things at the counter, if you need 4 servings, Of 4 ounces, ask for a pound, which is 16 ounces. So actually buy enough so that when you make it, you will have the right portions. In terms of the amounts at each meal, there is some data that shows that 30 grams of high quality protein at each meal might help promote muscle building or lean body mass synthesis. And so this becomes important because a lot of times people don't eat a lot of protein at breakfast. So I like to see people really try and boost their breakfast so that it does contain high quality protein. And what I mean by high quality is really bioavailable. And we typically think of animal sources in that context, but it is true that plant-based sources of protein can also be high quality. They're just not as readily absorbed, which is another reason why I do like to have some animal sources if you're willing to eat those. Okay, so this is just a bit of a summary, but in general, I want you to eat with a purpose, and I want you to pick high calorie, high protein, nutrient dense foods to avoid weight loss, to minimize muscle and fat losses since your metabolism is working against you there, to replete any nutrient losses or malabsorption, and to strengthen your immune system and really speed your recovery. In case you're thinking, I have not lost weight and this does not apply to me, you're in the minority from my experience, but I will say that it's also when you are fighting an infection, it's also not the right time, especially when you're in an acute phase, to lose weight because your body is under such high demand that you can very easily go into a deficit, that we would prefer you to try and, if you want to lose weight to maintain a healthy weight, which again, you'd be in the minority, we'd have you do that after you're kind of out of the danger zone, which would be any kind of acute flare or even treatment period. If you're on treatment for 12 months, we want you to get to a strong point before you're making those kinds of adjustments. Okay, in terms of nutritional supplements, a lot of people ask about this. I do think that a multivitamin is reasonable in this setting because your needs are higher. So we generally recommend an age-appropriate multivitamin that is iron-free. There is some concern, I would say it's not proven, it is not proven beyond a reasonable doubt that, but there is some concern that supplemental iron, not iron found in food, but supplemental iron might promote the growth of bugs, whether they be mycobacteria or other bugs. And so we don't necessarily want you to supplement with iron. And this is especially true if you are postmenopausal and don't necessarily need additional iron. I always recommend people choose a third-party certified supplement. And the big third-party certifiers, there are others, but Consumer Lab is one, NSF is one, and USP is one. And what these are they're organizations that are not connected to supplement manufacturers. They essentially audit the industry and they check supplements for making sure that there are no contaminants or toxins in the supplement. They also make sure that the supplement contains what the label says it contains and in the amounts that it says it contains. And they check for consistency between batches. So from a safety perspective and doing no harm, we want you choosing a third-party certified supplement. I also recommend people avoid mega doses, which means more than 500% of minerals and vitamins, unless you have a demonstrated deficiency, such as is maybe the case with vitamin D. But just to make the point about mega doses, there's enough data showing that mega doses could be more harmful than beneficial. So and a lot of supplements contain mega doses. So start looking at your labels and try and make a smart choice. In terms of vitamin D, this is a vitamin that we do believe probably it exerts good effects on most parts of your body, and your immune system is one of them. So when we identify a vitamin D deficiency, we typically will recommend ergocalciferol. That is a vitamin D2 supplement that you take in a very high dose on a weekly basis to treat the deficiency. And that could go for 8 or 12 weeks, sometimes longer as needed. Thereafter, you're going to want to be on 2,000 to 4,000 international units of vitamin D3 as a daily maintenance dose to try and maintain a normal level. Probiotics are something that we do recommend when we put people on long-term antibiotic therapy. And in general, we do people often come on probiotics. If you are using a probiotic and like it, I would recommend you continue it. We do recommend Gerdophilus in our clinics. It's something that we have found to be effective with the patients that we treat. We typically have people take 2 of those tablets twice a day. We tell them to take it with food so that you're not taking it with your antibiotics, which might be counterproductive. I just have a gallery of what I hope to be pretty photos, but I'm just going to try and comment a little bit on some foods that would be recommended in light of what I've already said. In terms of breakfast, this is a yogurt bowl, and I would pick Greek yogurt because it's higher in protein. If you need the calories, you should pick whole fat yogurt. There's granola on here because granola is super concentrated in calories, and it doesn't take a lot to get a very high calorie count. So a quarter cup of a very dense granola could be as much as 250 calories. And then add some fruit and put that on top of a good dense nutrient-rich yogurt, and you have a good breakfast. These are eggs with, you may not be able, there's smashed avocado on there on the toast and then a side of some tomatoes. You'll notice there are 2 eggs. So we've got protein foods, we've got some healthy fats, we have whole grain bread, which would be a more healthful carbohydrate, and some vegetables. A lot of times people will do toast, they'll be eating dry toast. I would argue you can't just do dry toast. It's not going to get you very far. It might be fewer than 100 calories per slice. And with your increased needs, that's a really weak choice. So we need to fortify that. I would pick thick slices of maybe dense bread, and I'd put a lot of peanut butter on there. So a tablespoon of peanut butter is about 90 calories. If you get 2 tablespoons, you'll be closer to 180 calories. So you can get a lot, and then you'll also get protein in there too. So you can get a decent amount of protein and calories in a breakfast that is toast with peanut butter. You can see I'm a fan of eggs with toast, but here we've also got more avocado there. If you're going to do oatmeal, you've got to add to it. The instant packets just aren't enough. And a lot of people do plain oatmeal. And so I try and get people, so I'm okay with oatmeal as long as there's a pretty heavy dose of, it could be nuts and or nut butter. As you'll see here, there's hazelnuts here and there's some kind of a nut butter. And so I'd be putting 2 tablespoons of a nut butter on there. I'd be putting at least a quarter cup of nuts on there. And then these bananas have been caramelized, so there's flavor. So the idea is we need to get protein in there. We need to get healthy fat in there, which is coming from the nuts and the nut butters, and try and also get some fruit. And if you're willing to fry it up a little bit, you'll get some extra calories as well as the antioxidants and other vitamins and minerals. This is overnight oats. Again, my point here, hopefully this looks really appealing, but the point here also is that there should be more to it than just the oats. Okay, if you're gonna snack, I have hummus. This is super colorful. And as a side note, the colorful foods are a really good indication that they're chock full of nutrients, a lot of which, a lot of which are immune boosting. But hummus is a good snack because it's chickpeas, it's a protein. And you can eat this with some kind of healthy carbohydrate, maybe whole wheat pita. You can put oil on it as it's done here to add some more calories. Nuts are a really good source of calories. So these are pecans. And I typically recommend unsalted nuts, just assuming there might be that's healthier from a blood pressure perspective. But lightly salted is okay, or a mix is okay. One of the points I make here is that a cup of nuts, pecans or macadamia, not every nut, but a cup of pecans or macadamia nuts are over 900 calories in just a cup. So it doesn't necessarily take a huge feast to really boost your calorie and protein, in this case, intake, but it does take a very calculating approach. And so I will tell people routinely, like, measure out a cup, eat them throughout the day. They're not going to fill you up with volume, but you're going to get a serious boost of nutrition to help you maintain a healthy weight, or in a lot of cases, restore your weight. This is a trail mix along the same lines. You can also snack. You can make your snack a mini meal. So this is my eggs, another rendition of the eggs and avocado. But don't be afraid to just eat a smaller portion of maybe what you would have eaten for lunch or dinner. Usually that will mean, so think of a snack as like a mini meal. There's good protein anchor there, and then it's rounded out with some other well-balanced types of foods. This is another version of hummus. These are muffins. So muffins are easy to eat. I would put peanut butter on these in order to fortify them, make them a little bit higher calorie, higher protein. You can do cheese and crackers. This is a lovely, like, seasonal brie with some cranberries. Looks delicious. For lunch and dinner, I do often recommend some kind of chicken or fish or turkey or seafood, or red meat too. I'm okay with some red meat as well, certainly high in zinc, which is a good immune boosting nutrient. But I like a protein anchor there. And I mentioned the 4-ounce portion. So that would be, this is a whole chicken leg here with all the extra meat. And you'll also notice that it's paired with potatoes that have been roasted in oil. So I do like to make the point here that I try and get people to cook with more fat, because it will add calories instead of doing a lot of raw or steamed vegetables. Especially if you're trying to gain weight or restore your weight or not lose weight, then you need the extra calorie density. And the food's going to taste good. It might also be more digestible and easier to get down that way too. These are fish tacos, super colorful. And maybe I can just, in addition to highlighting the color here, we're not just talking about like one. A lot of times people will say, oh, well, I eat a lot, but their serving size is just one small something. And you don't necessarily need to eat 4 or 5 tacos, but we are talking about 2 ideally, and maybe even 3. Try and increase your portions. I don't necessarily, you don't need to be feeling so super stuffed, but you should be feeling full. And especially if your portions have shrunk because you are not eating as much or you've been sick, you may need to expand your capacity, and that takes effort. This is a lentil soup. So lentils are protein. I would put some croutons on there. I would have some bread with this. You could put some cheese on top of it if you're open to that. And there's lots of vegetables in there. This is teriyaki chicken. And I'll emphasize that the portions are pretty big here. And so I try and get people to expand their capacity. Very colorful. Broccoli and red pepper, actually both high in vitamin C, which is a good antioxidant. This is creamy chicken pesto pasta. This is a beef bourguignon. So I am okay with some red meat if you like to eat red meat. And then this is a voodoo donut. So Denver has voodoo. A lot of people want to know where sugar fits in. And so this is a bigger topic in terms of sugar, but in general, sugar can be okay in the sense that a lot of people like sweets, And it's okay to have some sweet to kind of top off your feeding frenzy. A lot of times people fill up on their food, but they still have space for some treat. And so it helps just pad your diet. I don't want sweets to replace a meal, a nutrient dense meal. I don't want you eating half your dinner so that you can have a big old piece of cake or donut. I want you eating a nice, considerable, substantial meal. And then if you have a little bit of extra room, which you probably will, you can fit in an extra sweet. And that's how I would kind of balance that. I am okay with some sweets. They can make the gaining weight and eating more process just a little bit easier. And so I'm on board if they do that for you. Okay, so let's touch on reflux. So this is our last topic. Reflux is something that we focus on in our clinic because as you'll see, it can be considered a risk factor. In general, though, what it is reflux is a backflow of fluid or food from the esophagus or from the stomach. It's food material that's coming back up. This can happen both during the day and the night. So don't just think this is a night phenomenon. In fact, most reflux happens during the day because you're active and there's pressure on your internal sphincter muscles along your GI tract. And when there's pressure there, those internal muscles tend to relax, and then food material is allowed to come up. Keep in mind that proton pump inhibitors, that's what PPIs are, and H2 blocker medications, they don't necessarily reduce the amount of backflow. What they do is they suppress the acidity of that backflow. But the occurrence of reflux is actually the issue. So that's problematic. The concern is that some of this reflux may come above your sphincter muscle that you have at your upper esophagus. And if it comes up above there, then there's risk for you breathing it in or aspirating it into your lungs. That, we believe, can increase your risk for either developing or just exacerbating bronchiectasis or NTM lung disease. So we typically recommend reflux precautions to err on the side of safety because we believe it may protect your lungs. And we don't think it will harm you. The key is to adopt the reflux recommendations without being so restrictive with your diet or your eating pattern that you end up losing weight. So what we're trying to do is reduce reflux events, the amount of times that food or fluid comes up above that upper esophageal sphincter and could be aspirated. So we do know that losing weight, but this only applies in these special circumstances, with people who have bronchiectasis or NTM lung disease. If you're overweight and you're in a kind of remission strong period, it's okay to take reasonable measures to reduce your weight, particularly weight that's around the abdomen that can create pressure, upward pressure, and promote reflux. So what I typically will say is just try and avoid overeating at any one given time. That is also important, why it's good to concentrate your calories rather than eating a large volume at any one time. So that's not necessarily as big of a focus. Just know that it is one of the losing weight is something that can help, but only under appropriate circumstances. Elevating the head of your bed is something that's well known to reduce reflux events because you are using gravity. You're keeping your head higher than your digestive tract so that food is less likely to just come up on its own. That's very important. We would argue elevating your head to 30 or 45 degrees is recommended. Sleeping on your left side appears to be beneficial, and that's actually been demonstrated with good data, and it has to do with the anatomy of your digestive tract. So the right side is not recommended, the left side is better. Also, eating earlier in the evening, preferably 3 hours before you go to bed, so that food and fluid can move through your digestive tract rather than be sitting there when you actually do recline. In terms of drinking and eating, good beverages would be caffeine-free coffee substitutes, caffeine-free herbal teas, lower fat milks of any kind, non-citrus juices, and there's a variety of them, and water. So I try to make that list as long as possible because the what should you avoid tends to be a little bit longer. What should you avoid drinking? I have highlighted alcohol and carbonated beverages as probably the two biggest culprits. But we do know that caffeinated and decaffeinated coffee and tea might be problematic, and decaf still contains some caffeine. That's why caffeine free is recommended and decaf is not recommended. Chocolate and mint flavors are not recommended. Citrus juices can be problematic, energy drinks, sodas, and vinegars. And I'll just state this, if you have personal reflux triggers, you know that when you eat or drink something, it causes symptoms, then those are real for you. These tend to be general recommendations, but always also go by what your own individual triggers are. And if you have individual triggers, I recommend you avoid or minimize those. In terms of what you can eat, all the good stuff is on here. So lean proteins, grains, non-citrus fruits, almost all of your vegetables except for the really hot ones, hot peppers, for instance. Same with herbs and spices, most of those except for the really hot, spicy ones. In terms of what you want to avoid, I've again highlighted probably the more problematic ones, but chocolate, that also always comes, it always makes people frown, but chocolate can be a trigger. And then high fat foods that I've highlighted in orange, high fat meats, high fat dairy, fried foods in particular, anything deep fried, high fat sweets. And maybe what I'll say here is keep moderation in mind. So if you're going to enjoy something chocolate, try and do a small portion, try and do it earlier in the day. Try and make sure you're sleeping with your head elevated. In terms of the fat products, if you can choose leaner meats, if you can choose 1% or non-fat dairy, if you can avoid deep fried foods, maybe just a light saute or pan fry is okay, but nothing too greasy. And if you can avoid really high fat sweets in large portions and eat them earlier in the day, that's better. Other foods to avoid might be the hot peppers, anything that's vinegary or spicy or tomatoey, ketchup and mustard are condiments that come to mind. Mint flavored candies or gums. Spicy foods, a very common trigger. Tomatoes and tomato sauce, particularly the concentrated forms of it. If you can try and avoid, think of like lasagna or pizza that has that sauce that's really thick and concentrated, and vinegars. Lastly, some other diet recommendations for reflux. Avoid overeating, try and do small frequent meals so you do not increase upward pressure. Trying to limit your fluids is something that we say at National Jewish Health, because there is a thinking that if you fill your stomach with a lot of fluid, that it might be more likely to backflow or backsplash. So if you can limit the volume that you drink and then combine your fluids with grains or starches that absorb those fluids, you will be safer. So finally, in terms of a summary, do think of eating as a way to help you fight your infection. Food is part of your fight, it's part of your resistance. This also may help reduce your risk of disease progression. Note that infection predisposes to malnutrition, underweight, and weight loss. And the goal is to fight back with food to increase your immunity and to resist your infection. So the goal is, if you've lost weight or you're underweight, we do want you to consider restoring or gaining some weight in order to be at a healthier weight. If you are at a healthy weight, we want you to be vigilant about maintaining it, and it might mean that you need to eat more to do that. If you're overweight or have excess weight, be very prudent about when you take measures to modify your diet, and try and do it in a way that's not drastic. And then eat well. Choose protein anchors at meals. This will help you eat nutrient-dense foods. Eat regularly, eat balanced meals. And I've noted some appropriate portions of protein-rich foods that would help you reach the goals that we discussed already, about 30 grams, if you can hit that, of protein at breakfast, lunch, and dinner. And some of the other goals in terms of calories and protein, maybe probably most likely over 2,000 calories a day and probably over 75 grams of protein a day. And then reduce reflux events with diet and lifestyle precautions. And you will never have a greater or lesser dominion than that over yourself. So you are in charge and this is up to you. Our goal at National Jewish and here is to help support you do what you need to do to be as strong as you can be and be the best you. Thank you. And I'm happy to take questions.
Thank you so much, Michelle. That was wonderful. We have over 50 questions in the queue, so let's get started. So there's a number of questions about dairy. So the first one up is dairy always a bad idea for people with respiratory disease?
And the answer is no. So we teach that dairy does not necessarily increase mucus production. It's because it's not, believe it or not, it's not evidence-based to the point where it is a recommendation. So I would argue that dairy, especially in people who like dairy, can be a benefit because it helps people have more options to eat and dairy can be extremely nutrient dense. Having said that, in my experience, in all the respiratory diseases that I see, I would say I have seen fewer than 10 people, and I'm not kidding with that. I've seen thousands of patients. Fewer than 10 people have told me that dairy makes a night and day difference for them. In other words, if they cut dairy out, their life is changed. And I believe those people. So if you notice a significant difference with dairy, then you don't need dairy, but you do need an alternative to dairy. So if you cut something out, you need to replace it with something that's going to be just as nutrient dense and help you eat adequately.
Okay, so we have a couple of questions regarding the best way to gain weight or not continue losing weight without actually, without sugar. I guess some people have some concerns about blood sugar level as well. Can you address that particular issue in terms of balancing the need to gain weight with, sugar intake?
Yeah, that's a great question. So what I would say, number one, is when you're eating refined carbs or sugary foods, I would eat them in combination with mixed meals. In other words, I'm okay with you adding them in, but try and add them in at the end of a meal when you've had protein, high fiber foods, and healthy fats. The reason is the sugar is going to be more slowly absorbed if you eat it with a mixed meal than if you eat it standalone. So that is a good way to incorporate it. Incorporate it with other foods that have protein, fat, and fiber because you're not going to get the spikes after you eat. The other thing to do, obviously, is to eat a smaller portion. Try not to binge. Try not to be too excessive. So eat it in moderation. Those are probably my biggest. And then I'll say this: if you have diabetes, it's totally appropriate to take your medications as prescribed so that it helps you control your sugars when you eat carbohydrate. And I have even gone to the extent of telling people and counseling people on if they have diabetes, that it's okay to get additional agents or medications on board in order to help them eat more and control their sugars. Because food and adequate weight is that important. It can, in some people, be life-saving.
On the same vein, talking about sugar, somebody has asked, is there evidence that sugar feeds bacteria and mycobacteria, or that sugar makes antibiotics less effective?
Okay, that's an interesting question. So I think the concept that high blood sugars can feed an infection has merit in the sense that if you're diabetic and your sugars are uncontrolled, If your blood sugars are uncontrolled in a diabetic, they tend to have a harder time controlling the infection. So controlling sugars becomes very important. Having said that, people who do not have diabetes, their bodies do a very good job of controlling blood sugars. The body will generally keep the blood sugars within a normal range. Even if they spike, the body will secrete insulin to help bring that down. So I think the key is not to be too obsessive with this, because in general, if you're non-diabetic, your body can manage the carbohydrates that you eat, even some added sugars. If you're diabetic, you're going to have more difficult control with sugars, but you can still manage it with how you eat carbohydrates, the kinds of carbohydrate that you eat, and the amounts. And that's what you do in addition to taking your medication to make sure you control your sugars in that setting. You kind of have to work with it, but it's definitely something to work with in order to allow yourself to enjoy eating and eat adequately to maintain a healthy weight.
So we have a question from an alpha-1 patient with bronchiectasis. They were treated successfully for an NTM infection, and they now seem to be getting some gram-negative infections and Burkholderia. They have challenges keeping their weight up, and they need to gain weight. And they're asking about specific suggestions about when to eat, how often, what to eat. So can you tell us what parts of this are applicable to them as well?
So I would say it's all applicable. It is very important to get up as early as possible, eat breakfast, to snack about 2 hours after that, to have some kind of lunch 2 hours after that, to snack then in the afternoon, and to have a real dinner. And I know I may be repeating myself, but to pick protein anchors at every meal and snack, whether that's eggs, chicken, fish, or meat, legumes, which I mean beans, nuts, could be soy, or it could be a nutrition supplement. And don't exclude that as a choice. You can pick, you could pick an Ensure or a Boost if you're okay with that. There are other more natural supplements. Kate Farms and Orgain make really good plant-based nutrition supplements without a lot of additives per se. And you can also make your own shakes. Of course, that requires more effort, but there are a lot of protein powders out there that are pretty dialed in terms of being concentrated and tasting good. So you can add those. And sometimes it's completely appropriate to add those, and it's okay to get help like that. So if you are struggling with food, then consider some kind of supplement, whether that you make or that you buy.
Okay. Somebody is asking, is it better to eat poorly or poor nutritionally than it is to eat less or eat fewer calories?
Do I understand this question? Is it?
So I guess they're asking which is better, eating poorly or eating fewer calories, I think.
Okay, so I'm not sure I understand, but if you want to gain weight, I have seen people do it with like junk calories, and I don't know if you could say that's better. In terms of so I don't think I'm hitting the answer here. I am okay with some extra foods if they help you restore weight or gain weight if you need to do that. And what I mean by that is like the eating poorer foods, the more snack foods or the more sweet foods. I would say the weight is probably the primary, a healthy weight is primarily important. I don't understand the question, the fewer calories.
Yeah, I'm not, I guess they're saying eat, higher calorie foods that are not as nutritionally beneficial, or eat fewer calories in foods that are more nutritionally beneficial for you, that might still be more high calorie than the average food, but not, for example, maybe not, for example, fast food. So I guess maybe it's a question of fast food versus more nutritional, like would in terms
Oh,
of restoring weight, or is there a preference, or is there a balance, or like what, you know?
yeah. So ultimately, everything is a case by case basis. But I am okay with fast food if it's going to help you get to where you need to be. Um, and in fact, I was going to make that point earlier. Convenience foods or takeout foods might be needed. And if you can do the best you can, um, that's really what's important. And it may not be perfect, but don't let that get in the way of you eating adequately enough to be as strong as you possibly can be. I guess that's what I would say.
Okay. We have a question from somebody who they did have a problem with weight loss when they had MAC disease. They are now a little bit overweight, and they are asking if you have any advice or strategies on maybe losing that little bit of extra weight, which
Yeah.
can happen.
Yeah. So this can happen. I see it all the time. And in general, I think I would first want to know what it was that they did to put the weight back on. Did they kind of go overboard in an area, whether that be with the sweets or the more fast or junk foods? And can you just rein that in potentially? Um, I always look for, everyone has a weakness. Some people find that they snack mindlessly at night, or other people, they love ice cream. But what is it? I would try and hone in on what it is that is causing you maybe to overeat a little bit more, and try and pick the foods or the behaviors that aren't as helpful to you because they're not as nutrient dense. They're not wholesome, nutrient rich foods. And another just very basic thing is take your portion sizes and try and shrink them by, say, 25%. You know what you normally have been doing, which has caused some excessive weight gain. Can you just eat 75% of your usual, which would be 25% less? Try and just do an adjustment like that with everything you do if you can't identify some very obvious extras in your diet. That's pretty general advice, but it generally seems to work.
Okay. Um, we have several questions about vitamin D and vitamin D3. Can you discuss a little bit, for example, can you talk about the specifics of vitamin D3 and differentiate it maybe from other vitamin D complexes, and talk about maybe the dosing that might be needed, and how it plays a role in managing the health of an NTM and bronchiectasis patient?
Okay, well, what I can say is there are links between vitamin D and your immune system, your immune response, um, particularly when your body is in hyperdrive, trying to um, it's using your immune cells and then it's rebuilding them. Vitamin D plays a role in helping you remanufacture your important immune cells that are your defenses. And that's that's one of the ways that it plays a role. It strengthens your immune system, we believe. We have also secondarily found a connection in our clinics at National Jewish, where a lot of people who come in with NTM or bronchiectasis, they are either insufficient in vitamin D, which in our mind means their vitamin D level is below 30 or between 20 and 30. That's insufficient, according again to our standards. Or they are deficient, which means their vitamin D level is 20 or lower. And so what we're trying to do is restore that level above 30. Some of the clinicians in our practice like to see the bronchiectasis and NTM patients hit a vitamin D level of 50. That is based on our clinical judgment in our clinics. That is harder to do. But certainly we're looking for a level above 30. possibly as high as 50. We don't need much higher doses, much higher levels than that. And you could argue that if you run higher, you're running the risk of maybe inviting in potential harms. So I'm suggesting a range of 30 to 50. And the way to achieve that is going to be with supplementation, most likely, especially if you have increased needs or are coming from an insufficient or deficient state. And so depending on where you start, and I'm not the doctor, so I would defer to your provider on this, but I would follow a protocol if you're insufficient or deficient to replete yourself. Usually, that means one of two things: either vitamin D2, which is considered an inactive form, but can be turned into an active form in your body. It's a high dose of D2. And that's usually 5,000 international units of D2. Usually that's given weekly or twice weekly for 8 to 12 weeks. And then thereafter, we would have you start a vitamin D3, which is the active form dose, at a level of 2,000 to 4,000 international units a day, indefinitely. Another approach to treating the insufficiency or deficiency is actually to take a high dose vitamin D3 supplement. And I would put that in the range of 4,000 to 5,000 international units of vitamin D3 daily to replete yourself. And then again for 8 to 12 weeks. And then you could have your levels rechecked, make sure you're in the normal range. And if that is the case, then start a daily maintenance dose that might be in the range of 2,000 to 4,000 or at least 1,000 to 4,000 international units of vitamin D3 daily. I typically recommend a soft gel form of vitamin D3 or a liquid formulation. It doesn't have to be, though. I've seen people have good results on the tablet form, the like white small tablets, but the soft gels or the liquids formulation of vitamin D3, from my experience, tend to be better absorbed and have a more they tend to increase the levels significantly to the point that it's therapeutic. I recommend people take those supplements with foods that have fat, because vitamin D is a fat soluble vitamin. So in theory, it will be better absorbed when it is surrounded by other foods that have fat, some kind of fat. Doesn't have to be greasy, but some kind of fat. I think I addressed everything.
Can you quickly address the difference between like vitamin D3 and other forms of vitamin D?
So I'm not sure what people are getting at here, but typically there's vitamin D2 and there's vitamin D3. One of them, the D2, is considered the inactive form. It needs to be activated inside the body. And so if you take D2, it's activated when you eat it inside the body. You know, the other thing, I don't know if people are getting at this, but some plant foods like have vitamin D2 in them. Again, it's the inactive form. And so inside your body, it will be converted to D3, which is the active form that we think would have benefits for your bone health and for immunity as well. I don't know what other forms people might be talking about.
Okay, thank you. So we have a couple of questions about vegetables, in particular cruciferous vegetables and roughage. Some people have, difficulty digesting them.
Yeah.
Do you have suggestions for people who have those issues?
Yeah, so one of them is to blend them. If you're willing to experiment with smoothies, broccoli, believe it or not, if you buy it frozen, it will blend up in even a regular blender. A Vitamix will liquefy almost anything, but certainly you can blend them. The key is just to make it taste good. Kale also is like, think of the tough cruciferous. That will also blend even from fresh state, and it is fibrous, but it's much easier to digest. So I have my little I have my favorite green smoothie. So I often recommend that. And you just as a general rule, if you're blending vegetables, It's helpful to add some kind of fruit, which I'm okay with, as well as potentially some herbs. It could be parsley, goes well with kale. It could be mint. It could be anything that's got a good kind of refreshing flavor, as well as citrus. Um, that pairs well. Of course, that's not always recommended for reflux. I just realized I'm kidding. But if but you could do some citrus. You can also pair them with nuts or nut butters. So think of almonds or an almond butter or any kind of nut or nut butter. Additionally, you can cook them. So I like roasting them with oil. That will give you some extra calories too, but the cooking is going to break down, it's going to kind of pre-digest it for you. It's going to break down some of the fiber and make it easier to digest. So as long as you're not cooking it to the point of oblivion or like getting charred or just really limp, you'll still maintain a lot of the nutrients in there, and it will make it easier to digest. So I'm okay with like a light saute with oil or a grill or a roasting, or even like in a soup, something that's cooked.
Are there any particular dietary suggestions for vegetarians and vegans that you think should be shared so that they have that information as they're trying to deal with, managing their weight loss?
Yeah. So again, it's always helpful to do this on a case-by-case basis, but in general, people who are vegan or vegetarian might really benefit from a plant-based supplement, especially if they're struggling with weight gain. So sometimes it's just hard to do with food, meaning the weight gain or the restoring their weight. I also think of trying to make sure you have a protein anchor at all of your meals. That can be challenging. And so looking at what you're doing at breakfast, lunch, and dinner, and whether you're doing a dairy alternative like soy, which I actually would recommend because it has good quality protein, and at high amounts, similar to dairy, but would be dairy free. So you could do some kind of a soy product, whether that's a yogurt or a tofu scramble or something like that. But I would be looking for vegetarian or vegan protein sources that are anchoring your meals and snacks. I would be trying to rely on things like legumes, particularly legumes with added oils, so you get some more calories. And that's like making a bean soup, putting oil in it if needed, or doing your hummus, putting oil on top of it, or doing some kind of, thinking like a pesto bean pasta or something like that. I would be looking for ways to structure your meals so you're getting those beans, or doing nuts and seeds. There are other alternatives. I mean, I was just thinking today you could make like there's a mycoprotein called corn, which is essentially it's a vegan product, but it's a high protein meat substitute. And then I would also be looking at grains that are high in protein. So quinoa is going to be high. I'd be looking at ways to pick the nutrient dense foods and put them in their diet. You can also do a lot of seeds. A lot of people aren't doing pumpkin seeds or sunflower seeds, or chia or flax seeds. So I'd be looking at ways to incorporate those. And in general, you can eat a very healthy vegan and vegetarian diet. Of course, if you're vegan, you're going to be looking for a supplemental source of vitamin B12. And with vegans and vegetarians, you might also be concerned about calcium. You might be concerned about iron, be concerned about B12, and maybe some other vitamins and minerals. But what I want to say is in the context of fighting an infection, it's very reasonable to consider some kind of dietary supplement in the sense of a multivitamin, because your needs are so much higher. And then you're also adding in the element of the infection that you're fighting against, that an extra supplement is probably going to be beneficial to help you cover any gaps that might be in your diet, particularly if you're struggling with adequate intake or weight.
We have time, I think, for a couple more questions. And then for everybody else, we want you to know we are going to capture the remaining questions And we're going to start getting answers to those and building a question and answer bank on the website. So as that gets posted, we'll be letting everybody know. But let's go with a couple more questions. We have a question from somebody who they're on a low oxalate diet, so nuts are not something they can eat. They have found that adding, for example, something like Haagen-Dazs milkshakes every day, it's easier to maintain their weight. Um, is that something that would be problematic, or if it's working for them, they should continue doing it?
I think if it's working for them, then they should continue doing it.
Okay. The last one is we've had several questions about water consumption and how much water consumption is healthy per day, and the fact that a lot of patients are told that it helps thin their mucus secretion. So,
Yeah.
can you just address their water consumption?
Yeah, so this is tricky in the sense of the reflux recommendations, but I would just have people, number one, keep in mind that water is not the only thing that will hydrate you. There is fluid and water in food that you eat, as well as other beverages that you would drink. So I try and get people to think of fluid not just as water and to count their other sources. Coffee and tea, believe it or not that we want you doing those in excess, but those do count. Pretty much all beverages count with the exception of alcohol. So in terms of the amount of water that you need a day, um, you'll hear in the general media that 8 cups a day is what's recommended. I think that's not necessarily always recommended, especially depending on the climate you live in and the amount of activity that you get. You can probably get by with less than that. If you want to thin out your mucus secretions, though, I mean, I could ballpark it and say about 6 cups of total fluid a day. Again, trying to take into account all sources of fluid, which you may be surprised at how easy it is to get to that level with just some of the normal foods that you're eating and drinking. So I am giving a bit of a ballpark. I'm coming down less than the 8, but I'm not going too restrictive. I'm trying to find a balance, and to some degree, you have to balance this against your ability to maintain a healthy weight, because non-calorie beverages like water aren't always helpful. It's better to actually get your fluid from beverages that do have calories and then count the fluid in that toward your fluid requirement.
Okay, thank you so much for your time today. We have a
Sure.
lot of questions still, and we will work to get those answers so we can get the information up on the website for
Okay.
patients.
Okay.
So I want to thank everybody again on behalf of NTM and Phone Research for joining us today. We're very happy that you joined us. We look forward to seeing all of you next time at our next session. And we'd also like to thank again our valued sponsors, Insmed, Aflovest, Spiro Therapeutics, Maxor Pharmacies, and Beyond Air for supporting this program and for everything they do on behalf of patients. Again, Michelle, thank you so much for joining us today and for your excellent and informative presentation and for taking the time to be here with us today.
Thanks for
Thanks,
having me.
thank you everybody, and have a wonderful week.